So heart disease is the leading cause of death in women in this country. And on this National Go Red for Women Day, we want to make sure that our viewers have the information they need to avoid becoming one of those statistics. So take a look at this. Every year, a little more than 21 million women are diagnosed with heart disease in the U.S. Approximately 500,000 women die each year from heart disease or stroke. Now, these cases are actually preventable 80% of the time. So whether you are or have a mother, sister, wife, daughter, or a friend, listen up for some life-saving information. We are joined this morning by Dr. Iselma Fergus, and she was the Director of Cardiovascular Disparities for Mount Sinai Hospital, and one of her patients, Renee Pichardo. So good morning, ladies.
Good morning.
Thank you so much for being with us this morning. So as a cardiologist, Dr. Fergus, do women just avoid it altogether? Are they just not paying attention to heart health?
I think that women think they're protected, particularly when they're younger, that, oh, I can't have heart disease. This can't happen to me. It happens to someone who's older. So I think that a lot of times they may minimize their symptoms and not pay a lot of attention to really what's happening to them.
But that could be a very costly choice.
Oh, yeah. It could cost your life if you do have something and you haven't noticed it or paid attention to it.
Renee, let's talk about your situation. You were suffering from, what, panic attacks? But you didn't think it was a big deal, or what was your situation?
By the time I had panic attacks, it was a big deal. But I can think about a year ahead of that, I was having little fleeting dizziness at times, and would rationalize it out as it was something else. Maybe my sugar was too low, or maybe I'm tired, or whatever. And that went on for about a year before the drastic wake-up call came that you got to do something now.
What was that drastic wake-up call?
Panic attacks, uncontrollable, due to not getting enough oxygen supplied to the brain because my heart wasn't beating very well.
And the other thing is, you're diabetic.
Yes.
But you also have a family history,
Yes.
right, of heart disease?
I found that out, yes.
Wow. And that's something you feel like women really need to pay attention to.
Oh, absolutely. And Renee is a very important story because she presented with symptoms that one would not think would be related to a heart attack. So, quote unquote, panic attacks. She was dysfunctional. And when they brought her in, the first thing you do is an EKG.
Okay.
And when I did her EKG, her heart rate was so slow. I'm like, oh my God, we've got to jump on this right away. There's something going on. And so I immediately ran some tests and I immediately brought her into the, referred her to the cath lab. She got some assessment. We found out that she had blockages.
Wow.
Significant blockages, and that was causing her right coronary artery to affect part of her heart, making her heart rate very slow.
Yeah, and let's explain to our viewers how slow that was and what that could have meant had she not come to see you.
Right. So a normal heart rate, a normal sinus rhythm beats between 60 to under 100, 99. Her beats were around 29, 30.
Yeah.
Oh my gosh.
So when I saw that, I'm like, oh my God, no wonder you're tired and having heart attacks. And she ended up needing a pacemaker as well.
But even if you don't have a history of heart disease in your family, I mean, you really should get checked, or what would be your advice?
So my advice is, you know, women get checked out. They start getting checked for mammograms. They go to the GYN. Well, your heart, as you said, heart disease is 80% preventable, but you've got to catch it early. So particularly if you have a family history, you should get checked out early. But, you know, as you start approaching menopause, or even before that, you should go in and, you know, have a conversation with your provider, figure out what risk factors you may have, get your bloods checked, and then get the appropriate testing early on.
My big question, though, is why do people, or why do women especially, hesitate on getting checked? Because I have to admit, I, like you, I had panic attacks. I was having heart palpitations, like my heart rate was speeding up. I did go see a cardiologist. It turned out to be nothing, so I think maybe it was just stress.
Was great. Yeah.
But why was it that you hesitated to come and get
I didn't
checked?
recognize the symptoms as heart disease or needing heart intervention until much later, until almost the very, I hate to say end, but the closest to it, as hard as it could be.
Yeah.
But those fleeting bouts of dizziness, I go, oh, I stood up too soon. You know, I'm a healthcare provider also, so I rationalized it away. And as far as knowing about your family history, if you don't know, if your family has not discussed this with you, you never inquired, you wouldn't know to be aware of that.
Yeah, so you actually got a pacemaker, right?
Yes, I did.
Yeah. And how much has that changed your life?
It being functionally, well, it's improved.
Tremendously.
It's improved. I'm not tired like I was. I was the word fatigued, and I don't usually use that word. I usually say I'm tired. People will say I'm tired. But to say I was fatigued, yeah, I was. Suddenly I was fatigued for a whole month. Just, my God, everything is just an effort here. But it's 100% better.
But it's so easy to brush off symptoms,
Yes.
things that, especially if you're a busy parent, to just brush off and say, I don't have time to check.
Right.
What are some of the warning signs that women should be looking out for, where
Right.
they should say, you know what, this is not just a stressful day. You need to go and get checked out.
Right. So first, let me say that women's symptoms could be different. So when you read the textbook, they tell you about a positive Lizavine sign. So like an elephant sitting on your chest, pain radiating down your left arm. Women may present differently. They may have epigastric or stomach pain. They may feel tired. They may feel like it's the flu or something else. But women know their bodies. If things just feel very different and not going away, and sort of pervasive, like just very, you feel frightened, you kind of know there's something wrong, then you go and get help, whether your symptoms are typical for heart disease or not. And if your provider doesn't listen, then find one who does, because they really should pay attention to your case and listen to what's going on.
And I think it's so important that you mentioned the fact that symptoms for men and women
Can be different.
are different. But thanks again for both of you. I'm so glad
Thank you.
that
Thank
you're
you.
doing better.
Yes.
Thank you.
Yeah, and thanks for taking the time to bring
my
awareness
pleasure.
to cardiovascular and
Yes.
disease in women.
I hope this show helps some woman out there who's listening in and who will go and get checked out and hopefully get a better life,
Exactly.
or a healthier life.
You have to encourage your friends,
Of
everyone.
course. Look out
Really.
for each other.
Yes.
All right. Thank you again, ladies.
Thank you. Happy to be here.